The opinions expressed in the following program are those of the participants and do not necessarily reflect those of Rogers or Rogers TV.
Welcome back to Health Matters. I'm your host, Sunita Mohan. We have two amazing guests with us. We have Kyle Ardill, who has been on my show before about a year and a half ago. I can't believe how time goes fast. And then we have a new guest, is Dr. Jason Pajaczkowski.
Perfect.
Did I say that right?
That was perfect. You elevated me to a host there, too.
Yeah, I was going to say host, guest. He's my guest. So welcome to the show, guys. And I know, so we're going to be talking about something different that I normally don't talk about on the show. We only talk about nutrition and diet. And I know, Kyle, you were on the show before with Dr. Gopal Bhatnagar, and you're his personal trainer, and we were talking about, you know, training, staying active. But now we're taking it to the Olympics. And in celebration of the Olympics, that's what our topic is going to be about.
Of course.
So I'll start with you. So I know that you have a new gym or health fitness club.
Yeah, so what we've done is we've taken basically an all-encompassing approach to health and wellness. So we've incorporated what Jason does, chiropractic. Mm-hmm. So we have chiropractic care, massage, physiotherapy, and as well as the personal training. So what we're trying to do is develop a roundtable approach where we all work together to optimize the health and the wellness of our anyone who happens to come in the facility.
So Jason, tell us about you're a sports chiropractor?
Yeah, so chiropractic offers a few specialties, not nearly as many as allopathic medicine. So yeah, I've been fortunate enough to have specialties both in sports medicine and orthopedic rehab.
Right.
So yeah, that's working with Kyle and with the rest of the team at SWAT has really been exceptional for me. You know, I spent a lot of years working with different professional teams, Olympic teams, Paralympic teams, and even working in the clinic setting, it's always been something where people work. I've been in situations where people work well with one another and that they get along well, but they don't really work towards making a patient better. And the thing that Kyle touched on that we do at SWAT every week is a roundtable approach, where we'll actually sit down and talk about each specific patient and everyone who's in training, and we all get to have our input into that area. So it's great for me because it touches on my skill sets, but it's great for everyone else. It touches on their skill sets, and we're really able to learn from one another. So it's been pretty exciting. That's
great. So tell us a little bit about the kind of clients that come into your I don't know, clinic, spa, what should I call it?
But certainly not a spa. You can call it a clinic, training facility, you can call it home.
Okay.
But our clientele ranges, I mean, from 12-year-old athletes trying to get their bodies ready for their upcoming season, all the way to a client of mine, Carolyn, who she's 69 years old. She's turning 70 this year, and she's looking to do 7 half marathons this year.
Wow.
And 7 at 70, which is pretty phenomenal. As well as NHL athletes, OHL athletes, football players, the works. But also, people just trying to stay fit and feel good. Business owners that understand the importance of health and wellness and maintaining that and making themselves better so that they can help their business and help their lives and their families later on in life.
So what kind of injuries do you see?
Wow. Well, we really see a broad spectrum. I mean, we sort of function on multiple levels, and I think that's reflected, or I guess indicative of sort of the patients that we'll see. So from a sort of mature athlete standpoint, Olympic, professional, Paralympic, again, we'll kind of see two different spectrums where we'll have some of them that come in that have acute injuries. Especially, I do a lot of work with MMA fighters, so we see a lot of acute injuries. And then we'll see kind of the other end of the spectrum where we get athletes who come in and say, I've got something that's been nagging for a while and I feel like there's a performance issue. And so we'll go in and have a biomechanical look and see what factors are contributing to that. And again, sort of go into diet, nutrition, and other avenues. And one of the things that we've started to do a fair bit of, which is super exciting for me and I think touches on all of our skill sets, is when someone comes in and says, you know, I don't have a specific injury, or there's not something that's really nagging at this moment, but I want to run faster, I want to throw harder, I basically want to be a better athlete. And whether that's professional or just, you know, sort of recreational,
Right.
we get to take a step back and again look at them holistically, or what we sort of interpret as being holistic, in that we look at every single facet that we can possibly touch with our group that we have at SWAT, and then we all have input into that. So that is a lot of fun for us. But yeah, again, primarily we're sort of acute injury management or sort of chronic performance type things that we see.
And for like people, I used to run.
Yep.
So I know that running is very important, that you know the right way to run and where you can get injured, because I think there's a lot of injuries from people just getting out there and running without any specific training
Yep.
or know-how how to do it.
Absolutely. And I think that in a certain extent it's kind of the nature of the beast, as much as you don't like to say it. You know, when you're out there and getting fit and being active, you do get some issues that creep up from time to time. And certainly there are things that you can do preventive-wise. So running in particular, we see, like if you sort of look at the literature in terms of what running injuries are most prominent, you're pretty much patellofemoral pain syndrome and IT band syndrome are the two big performance limiters. And oftentimes people who have gone somewhere for therapy end up being not really satisfied with it and haven't really got it resolved because they haven't really gotten to sort of the specific issue. Yeah, I kind of feel like I'm on the same track again, but the way that we approach things is actually looking at what causes injury. So it's easy in an acute sense when someone comes in and says, you know, I've been hit, I've you know, been in some form of an accident, a car accident, a sporting injury. But when someone comes in and says, you know, I've been running for 6 months and all of a sudden I develop pain in my knee and it's getting progressively worse, I mean, there's a mechanism there. The mechanism isn't trauma, though. And typically you have to go in and explore all the different aspects of it. And so that's where, you know, the fitness end comes in, the massage end comes in. We come in on the performance side, and then nutrition as well.
Yeah, I mean, knee injury is one of the biggest things that actually stops people from continuing to exercise because they're afraid. And once you injure your knee, then you're like, okay, I'm going to stop. And I think that's what we want to talk about after the break, is that not to let injury actually stop you, because that means that you actually have to work that area a little bit more.
Agreed.
So we'll talk about that right after the break. This is Sunita Mohan. This is Health Matters. We'll be right back. For more information, visit www.swathealth.com or call 289-297-SWAT 7928.
The opinions expressed in the following program are those of the participants and do not necessarily reflect those of Rogers or Rogers TV.
Welcome back to Health Matters. I'm your host, Sunita Mohan. We have these two good-looking guys in studio with us.
Stop.
Kyle Ardill and Dr. Jason Pajaczkowski. So wonderful. So we were talking about, before the break, about injury and pain. So I'm actually an athlete. Not athlete, but I'm active.
You're an athlete.
I'm an athlete, yeah.
You're an athlete.
So I ski, and I started skiing this year, and I do hot yoga every day. Like it's an hour to 90 minutes a day. So I'm very religious about it. And so one time on the ski hill, I fell lots of times, like 4 or 5 times, because I went on a newer hill.
Typical.
And when I woke up in the morning, I had this pain on the side of my knee that was really painful, and I thought, okay, this is what probably my patients go through, and they're like, and then they stop exercising. But you know what I did? I still kept going. So what do you think of that? Is that the right way of handling pain? Because I find even when I do yoga, or there are some times when I have massive, like I did Pilates and I had shoulder pains to the point where I couldn't even sleep. Like if I turn on one side or the other side, it was that kind of pain. But then when I kept going at it, the pain went away.
Well, in my eyes, I mean, I'm certainly no doctor, but I would have to say that anytime that there is specific pain in your body, don't be scared to go see someone. There's so many ways that people don't look into to actually try to better themselves, and I think that they just deal with pain. And from injuries such as falling on a ski hill to reoccurring injuries from running.
Right.
There's so many ways out there to get better, and if you're trying to do these things and stay active and have fun and do all these sorts of things, if you're not taking good care of yourself and proper care of yourself, then you're going to limit your ability to be able to do this over time.
Right.
Dr. Paj can kind of touch a little bit more on the actual diagnosis of people and perhaps even your knee.
Yeah.
But the point is that when people feel pain, the important thing is to not diagnose yourself.
Right.
And that's why we have Dr. Paj.
Right. Exactly. That's who I needed, actually, chiropractor.
Not WebMD.
That's what I was
Right.
feeling. I was like, oh, if somebody could just adjust my back and my neck, everything would be fine.
Right.
Yeah, so there's an interesting break-even point that I think we're kind of all touching on, which is a certain amount of discomfort or pain post-exercises is probably a normal thing. And I think when you extrapolate that, especially into a rehab setting and people who have been in workplace accidents or motor vehicle accidents, oftentimes hurt is synonymous with harm to them, and so they avoid everything, and that's
Right.
just not the case. So I think as Kyle said very succinctly, we want to get people to come in and certainly look at injuries to make sure that it's sort of normal in terms of trying to condition yourself or train yourself. Like that part of working out and being active is par for the course. But it's I think most people are body aware enough that they can get a sense that wake up like you do. You woke up and there was a bruise there. You thought,
Yeah.
well, this is not really sort of performance related. It seemed like there was perhaps some trauma involved. So at that point, you do want to reach out. And I mean, not us personally. I mean, we do personally, but everyone really has so many great resources available to them. I mean, we really do live in a pretty amazing age in terms of what we can deliver patients as far as healthcare. And I know specifically we have a unit at our clinic called a frequency-specific microcurrent. And it's able to reduce inflammation and speed up healing in tissues. And we've just over the last week or so, it's amazing how many calls I got referred a professional boxer, and so we took a look at him, put the machine on him, and since then in the last 3 or 4 days we've gotten about 4 or 5 other calls from professional boxers that he knows who have nagging injuries. So it's interesting how much people are willing to sort of put up with in terms of pain.
Yep.
and what's actually out there that can help them out.
So what is this? It's a machine that you...
It is a machine. So any modality that you use. So if you went to a clinic, they would use ultrasound, interferential current, those types of things.
Laser.
Yeah. So they all operate on ostensibly the same physiological principle, which says that when a cell is injured, if you can supply it with energy that it can use, so it's almost like bioavailability, if you will, if it can take that energy that you are giving it and it's in excess of what it needs to do its normal respiratory function, it will actually take that excess energy and use it towards tissue repair. And frequency-specific microcurrent, we've found, does that better than any modality that we have. To the point where we'll put it on someone. And the protocols are probably a bit lengthier than people would normally expect at a physio place. But when they actually get off the machine, there's like a noticeable dramatic improvement. And even and there's certainly something to be said for a placebo effect, but even in people who are skeptics will get up and say, wow, like that feels remarkably different. So we're able to, by playing with certain factors, again, the nutritional aspect, having a anti-inflammatory versus a pro-inflammatory diet, using different modalities, and then using things like acupuncture and certain soft tissue techniques are able to really accelerate healing.
Yeah, and I think that's what we talk about on the show a lot, is that if you give the body the ability, it has amazing ability to heal itself.
Yeah.
But sometimes it needs help. And then if you provide that energy or any modality that helps the body find its way to heal, and that the healing is faster. So I mean, I think laser treatments. I know some chiropractors use laser treatment for inflammation and for pain management. And I also, after the break, I want to talk about there's also light therapy that is used for injuries and to help people with inflammation and pain. And so when a person, when you deal with athletes and when you're dealing with Olympic level athletes, so what are their injuries like?
Well, I mean, injuries can range in athletics from, we can just use my body for example, ranging from concussions to reconstructions, knee, ACLs, MCL. The list is endless, and Dr. Paj has seen them all. I personally have dealt with an awful lot of injuries in my athletic background. That's why this business specifically is extremely gratifying to me. Is to be able to watch guys like Dr. Paj and Dr. Giannoni and Giancola have people walk in who are feeling pain that I've felt, and walk out feeling like a new person.
Okay, so we'll be right back after this break. I'm your host, Sunita Mohan. This is Health Matters. For more information, visit www.swathealth.com or call 289-297-SWAT 7928.
The opinions expressed in the following program are those of the participants and do not necessarily reflect those of Rogers or Rogers TV.
Welcome back. I'm your host, Sunita Mohan. This is Health Matters. We have Kyle Ardill, and now I'm going to say Dr. Jason Paj, back with us for the last part of our show. So now I forgot what we were talking about before the break. Oh, your injuries. We were talking about your injuries.
We were talking about injuries in general, and I was just saying that being able to, and actually in the break we were talking about how you say when you fall and you hurt your knee or this and that, you're falling too much, and that's the that's the beautiful part about SWAT specifically, is that our mindset is that if someone comes in, we're going to make them better, but after that we're going to keep them better. And generally the best way to do that is through the training and the proper nutrition and that sort of thing. So
So you're asking me to come to your
I'm saying hey, I mean yoga 6 days a week is fantastic, but maybe you should pair it up with a little bit of weight training.
Okay.
Just saying.
All right, I'm in. I'll sign up for that, no problem.
Yeah.
So another thing you were talking about is prehab. You're talking about rehabilitation, and then there's something that you do before that to get people ready.
Right. So what you want to do is, if someone says, well, I want to get fit, and then they just hop back into the gym, something that they were doing 20 years ago,
right?
And they haven't been working out, your body's not necessarily ready for what you're about to do.
Right.
And that's the beauty about our approach, is that we're able to have Dr. Paj and other of our chiropractors take a look at people before they actually start to train. So that we can develop a way in which is best for them. Dr. Paj?
That's very accurate. I don't know what I can add to that. But yeah, that's, prehab sort of comes, I think, in two forms for us. So one would be, as Kyle suggested, so trying to get someone ready to sort of embrace and be able to accept the load that you're going to put on it from a training point of view. The other thing that we do see, which we had really good results with, is actually prehab that's pre-surgical.
Right.
So everyone's familiar with rehab post-surgical, but if you actually prehab it on the front end, the recovery time decreases dramatically. So
Wow.
we've had really good success with that, especially in knees.
And I know, Kyle, you work with, I like to mention my favorite doctor all the time.
My favorite doctor, too.
Yeah, Dr. Bhatnagar. I know he's on the show a lot. So what I love about that is that, he has a personal trainer. And he's, I'm going to say his age, 50-something, I think.
52 years old,
52 years old. And he is the chief of cardiac surgery, which is brilliant. And he practices what he preaches, which I really love, and I don't think we find too many doctors like that. And and how did you work with him when you were training him?
Well, I still train with him. I don't look at Dr. Gopal as a client anymore. He's a dear friend and a mentor of mine. He's one of the most brilliant individuals that anyone will ever meet.
Right.
But one thing I remember specifically that we talked about last show was people not having the time, saying that I don't have the time to train, I don't have the time to go get fit, I don't have the time to go see a chiropractor.
Yeah.
And if there's anyone in the world that I've ever met who doesn't have time,
I know.
it's Dr. Gopal. He's helping people, fixing people's hearts every single day, all day. And he always makes sure that he finds time for the gym, finds time for his kids. The guy is a truly an inspiration. And if you ever find yourself saying, well, I don't have time, then you need to meet someone a little bit like Gopal, and you'll find some inspiration.
Yeah, I mean, he's a surgeon. Sometimes when he comes on the show, I can call him the night before. And he'll come to the show. He'll come out of surgery with his scrubs on and come on the show. That's how dedicated he is. And that's why, you want to set that example for people, is that why wait to the point where you're unable to do something? Start early, and a lot of the things we talk about is about kids, like kids who are active. And you were saying that you do have people that come in younger.
Generally athletes.
Yep.
Generally athletes. Parents, unfortunately, and specifically, if they're not going to take the time to make it an important part of their life to either eat well or train or be active in general, generally that's going to fall into their kids, and unfortunately that's a huge problem in our kids these days, is that they're overweight, and they're overweight because they're not doing anything.
I know.
It's learned behavior.
It's learned behavior, and it is an epidemic. And we talk about that a lot, and Christian and I talk about that on the show too. That it's just knowledge about food, and it's not just that exercise is going to do it or food is going to do it. It's a total lifestyle, and that's what I think in your clinic. What you're talking about is the round table and people getting together as a team and then assessing your clients is what it's all about. Working, not just going to see a chiropractor and just going to see a personal trainer. It's more, and I'm really thrilled. I want to come and see your clinic. It's in Port Credit.
Port Credit, yeah.
Port Credit, and that's a lovely area to be, by the lake and all that. And when did you guys open?
We opened December 11th, 11, 12, 13.
Okay.
And
11, 12, 13, I like that.
Yeah, we actually just had our grand opening last Tuesday, where we had Hazel McCallion, the amazing Hazel McCallion, cut our ribbon and be an honorary SWAT member, and she was ripping it on the bike. The woman is absolutely phenomenal. Yeah. And I'll tell you what, if you want to live until you're 92 and want to live well, no matter how old you are now, get at it. Get after it,
Our mayor is the best example.
She's a prime example. Gopal Bhatnagar, Hazel McCallion.
Yeah. And she must be close to 90.
She's 92.
She's 92.
She's
93 today, I think, or tomorrow.
93
but wow.
On the 14th February.
No, I've met her. I've met her at the Trillium Gala, and she's like dancing Indian dance with us and everything with her. Sorry. So, anyways, it has been a great show. It has been a great pleasure having you guys on the show, and I'm gonna come and visit you guys for sure.
Promise.
And maybe you guys might need some homeopathic help. Anyways.
I'd be happy to, yeah, absolutely.
Okay, so that's the end of our show. This is Health Matters. I'm your host, Sunita Mohan. See you next time.